Hey, everybody, I'm Dr. Nick Circolone. I'm so excited to be here. Let me tell you something. I am pumped up. We've been doing radio for about 20 years, and now we're actually moving from the radio to Facebook Live and to YouTube Live. We're going to have basically, our radio show is moving to live video. I'm so excited about that. I hope you guys are too. If you've been listening to Health Chat before, what we have is a medium where we do health and different topics related to health, whether it be physical health, spiritual health, mental health, emotional health. Anything that has to do with health is what this show is going to be. I'll kind of give you a format. This is like our first live show, which is Monday, the 17th of August, which is, I can't believe we're in August already. I mean, I just think a couple of months ago, we were in a lockdown in our pandemic, and I've been stuck in my bunker, and we probably haven't really talked too much about this on the radio, but I've actually stopped doing that for a while and kind of wanted to revamp and get everything together. And hopefully everybody's doing well out there. You've been healthy. You've been staying healthy. And as a matter of fact, after the video, or after the live performance, I'll have a video on the other end of this talking about my thoughts on wearing a mask. It's going to be a short little thing. So let's get started and see where we're going to be going with the show. First off, my name is Dr. Nick Circolone. I'm a chiropractic orthopedist in Chattanooga, Tennessee. For those of you who have never heard of a chiropractic orthopedist, what we are is a branch of chiropractic that has gone through extensive training, actually 3.5 years of training, to develop a more holistic approach to orthopedics. And what we do is we are kind of that middleman between medical and chiropractic. Now, I am one of those. If you've been listening to chiropractic videos before, or you've been hearing chiropractic podcasts, I am not one of those who specifically talks about medical or chiropractic individually. I use them both because both of them are beneficial to the health of our patients. So that's where my chiropractic fellowship comes into play, which is kind of cool because if you come to see me, you're not going to get surgery. I'm going to give you kind of the best case scenario for you to get better and for things to function better. Now, remember, what I do, and if you've been listening to the show for years, you know that my primary focus. See, I make mistakes too. Our primary focus is on function. My job is to get you functioning back to normal as close as we can get to normal, because sometimes, there's some damaged tissue, there's damaged bone, there's some damage to ligaments and tendons, which are going to preclude us from really getting back to that normal stage. But what we try to do is get back to function. So I'll talk a little bit about function. Actually, I'm going to talk a lot about function and how it's going to affect you. So the way the show is going to run, we're going to have a 20 to 30 minute segment. We're going to be talking about all kinds of different things. As I said earlier, we're going to have guests on the show, and they're going to be able to answer questions that I feed them. But we want your questions to be asked as well. Unfortunately, because of the time frame that we have, we are not going to be answering questions directly that you put into the chat. However, any question that you put into the chat, we will try to answer at a later date. I may answer that in midweek. I may answer that on the next show. I may do a small little video with the doctor or professional that's on with me and just answer a couple of those questions. So we're just developing this right now. So kind of be patient with me. We're going to make mistakes. You're going to hear me say some gaffes. But you know what? What I want is your input on how we can make the show better, and what's going to be able to please you and something that you're interested in. So, for instance, one of the things that we talk about in the office a lot is headaches. And I'm going to get into that a little bit towards the end of the show and tell you how we look at headaches and how I treat headaches. So, again, I've been practicing now almost 30 years. I can't believe I've been practicing almost 30 years. I know you guys are looking at me going, oh, he can't be that old. Well, I'm not. I started when I was 12. I was, no, actually I didn't. I was 29 years old. I was very blessed to be able to become a doctor at 29 years old, which was one of those things where I never, ever thought I would be. I thought I would be in a totally different place when I was older, but God has different plans for us. And mine was to become a doctor of chiropractic, which was awesome. I love what I do. I tell everybody, you love what you do if you would do it for free. And when the Lord blesses us financially, I will still continue to do chiropractic for free because I love it that much. And I love to teach. So a lot of the show is going to be teaching you things about what I do and teaching you things about other disciplines which you may not know or want to know. And then again, I encourage you to ask those questions to me. You can actually get on to Facebook and follow us on our Facebook page, which is Apple Physical Medicine and Rehabilitation. You can get to us on Instagram at Apple Physical Medicine and Rehabilitation. And you can get to us on Facebook just by typing in my name, Dr. Nicholas J. Circolone, and you'll get right to the point. So let's get started with one of the questions that I was asked later on last week about headaches. Well, I've had several patients that have come in with headaches, and headaches are kind of my, I guess, pet, because I became a chiropractor because of headaches. A little history about that. I was in a car accident when I was 7 years old. I crushed the right side of my skull and broke my right leg. Well, in the process of all of that, I was in the hospital for about 2 months, and they didn't know whether or not I was going to have long-term damage, which, praise the Lord, I did not have. Now, with that, I did get headaches. And headaches that were so severe, and a lot of you who have headaches can probably relate to this, the headaches were so severe that I had to take a barbiturate to get rid of the pain. Now, I was doing this at least 4, sometimes 5 times a week. My headaches would debilitate me. They would cause me to throw up. They would cause me to have stomach issues. They would cause me to have vision issues. And again, if you have had a headache, you can relate to some of the things I'm talking about. But what chiropractic did, which was awesome, is it actually took away a lot of my headaches in the beginning. Real quick story. I was working on a construction job and I hurt my back. So I went to the chiropractor and I'm like, I don't want to go to this guy. But I went anyway. He adjusts my back. I jump off the table. I'm like, we're going to have to go do a throwdown right now because that hurt. And he said, no, come back. We'll take care of a couple other things. Never talked about my headaches. So I go back the next week. He adjusts me again. But what I realized is that I didn't have headaches. And I was like, did you fix my headaches? And he was like, we didn't even talk about your headaches. I said, well, I've been having these debilitating headaches for years. And this past week, they were really mild compared to what they've been. And he was like, well, chiropractic can fix that too. So we did some other things. And what happened was, in the beginning, he was able to decrease the frequency of my headaches, but not the intensity. Over time, my headaches have decreased. The intensity has decreased. And my use of medication has been non-existent. Now, I will say this. I still get headaches at 58 years old. Now, remember, I was 7 when this happened. At 58 years old, I still get these headaches, but they are far and few between. I probably have a really bad headache maybe once a year. I have headaches occasionally, but easily go away. So if you're dealing with headaches, there can be reasons that chiropractic can actually help these debilitating headaches. Now, there are other reasons for headaches that we just can't control. I mean, unfortunately, there is some organic stuff which causes headaches, such as tumors or environmental situations, which headaches will not go away with chiropractic with that. They just won't. But I will tell you this. If your headaches are musculoskeletal related and even environmental related, because the environment does affect the musculoskeletal system as well, if you have headaches like this, chiropractic may be what you need. I have a young girl that's a patient of mine. I don't want to mention any names, but she was constantly getting injections for Botox, and she was having them across the forehead and then down into the jaw area. Well, she came in to see me, and her parents go, "Can you help her?" I said, "Well, we could give it a try. I don't know." And I give her the same pat answer that I gave everybody else. We can either decrease frequency, we can decrease the intensity, or we can do both. So what happened was we started treating her, and within 2 visits, her headaches started to dissipate. Well, I've seen her several more times, and now she doesn't even have a headache like she did before. And when she does, the intensity is far less. So not only did we decrease the frequency, but we also decreased her intensity. So now she can function. She is 16 years old dealing with these headaches. And I'm telling you, when I was that young and dealing with these headaches, it's no fun. It ruins everything. If you have the headaches, you know what I'm talking about. If you know somebody that has these headaches, you know what I'm talking about. If you're taking medications for these headaches and you want to get off some of this medication, our office or chiropractic may be helpful for you. If you have any questions, if you're not in my area and you need to find somebody that is in your area that can deal with some of this stuff, just send something in the chat. I will look it up for you. I will find it. And you can even call me or email me, because you can email us at healthchat. That's healthchat with 2 T's at gmail.com. And I'll answer your questions. You can even call my office at 423-855-7376. And one of the ladies in the office will pass the message on to me, and I will personally call you and help you if I possibly can. Well, we talked a little bit about headaches. We talked a little bit about what we're going to do. We talked a little bit where the show's going to go in the next several weeks. And again, every Monday night, we're going to have this show. So we're going to be here for you. This show is your show. I'm just a host talking about the things that you want to talk about. And I am so pumped up that we have this new avenue to use now with Facebook and for YouTube, because without these, we would only reach a small amount of people. But with this, we can reach a vast number of people. So if you like the show, if you want to see more of the show, always leave it in the chat, email me, call me, subscribe to our pages, like us on Facebook, and tell your friends about us. Because the more people that see the show, the more questions we get, the better it's going to be. Well, guys, this is the end of today's show. But next week, we're going to have another new show planned for you. I'm not sure what we're going to talk about. Everything changes. Sometimes I get hijacked, and it's like, oh, you're going to talk about this? No, we're going to talk about this. Well, guys, have a great week. Enjoy. God bless. And have a safe and wonderful week. I promised you I would answer the question about wearing masks. Are masks necessary? Well, look at it this way. Research shows either way. Either they're good or they're not good. But I'll tell you this. If it helps a little bit, that's okay. If it helps a lot, that's okay. I look at it personally. If I wear the mask, I may be helping somebody. If it's helping a little bit, that's great. If it's not doing anything, I'm still good. So I encourage everyone, if it is a requirement for you to wear the mask, wear the mask. Don't wear it below your nose. Don't wear it on your chin. Don't wear it on your head like a cap. Wear it correctly, because if it is helping, then it'll be more effective if it's worn correctly. Again, this is a personal opinion about wearing masks. I don't like wearing a mask. I'm going to tell you that right off the bat. I was one of those in the beginning that was like, I don't want to wear a mask. Don't force me to wear a mask. But as I thought about it, and as I looked closer at some of the statistics and some of the research, I figured, you know what? Wearing the mask can only help. Well, guys, hopefully this helps a little bit. It eases your mind about if you're going to wear the mask or not. But, my first question I tell everybody is, be honest with me. Does this mask make me look fat? Guys, have a great and blessed